There's an elephant somewhere. Yeah, very
There's
good.
always an elephant in the room.
I'm done.
Let's see, which one is first? You have two bills, Senator Lara, so we're down to file item 5. This is the elephant bill. Was vetoed by the governor last year, and you're
Safety bill.
back. And please begin.
Thank you, Madam Chair and members. SB 1062 is a compassionate measure that protects elephants by prohibiting the use of bullhooks. Time in and time out, the bullhook has been directly linked to inhumane treatment of these delicate animals. Last year, as you noted, the governor vetoed a similar bill I authored on this matter that criminalized the use of bullhooks. The bill before you today is a more reasonable approach and addresses the governor's veto. Simply, the bullhook is used on an elephant, then there is a civil penalty instead of a crime that we were seeking before. So this is a much more reasonable approach, and it really addresses the governor's concerns. You also may have your permit taken away by the state. To the opposition, the intent is not to criminalize the bullhook, but to address the issue at hand with a modest and reasonable approach to clarify that there are more efficient means to maintain elephants. This bill does not preclude elephant handlers from using other methods of interaction. Should there be any alternative forms that the scientific community endorses, this bill as written allows them to be in practice. My concern is with the bullhook, a tool used only to abuse and mistreat. I respectfully ask for your aye vote.
All right. Do you have witnesses in support? Yes, please.
Good morning, Chairwoman Pavley and members of the committee. My name is Gina Kinsley, and I'm the co-elephant manager at the Oakland Zoo, and I've been working with elephants for 10 years. The Oakland Zoo has been managing elephants for over 40 years, and we were the first to start using a management style called protected contact, which we implemented over 25 years ago. With 4 African elephants under our care at the Oakland Zoo, our style of management through the use of operant conditioning and positive reinforcement, the staff uses target training paired with food and praise and tactile touch to accomplish all husbandry and medical needs. The management style ensures not only the safety and care of our elephants, but also our staff. The bullhook has one purpose: to inflict pain and instill fear in an elephant in order to control it. This method requires trainers to forcefully hook, jab, strike elephants who miss a cue, move too slowly, or display unwanted behaviors. To these trainers, this is the standard use of the bullhook. To anyone else, it's abuse. As long as the elephant fears the hook, the mere presence of it is enough to control them. There is no such thing as misuse of the bullhook. Its use is abusive fundamentally. The bullhook is not like a leash on a dog or reins on a horse. It is something to be avoided by an elephant because it only represents pain. With over 70 years of elephant experience combined at Oakland Zoo, we have been trailblazers when it comes to advocating for the welfare of animals, and in particular against the use of the bullhook, including in the fall of 2014, aiding and banning the use of the bullhook in Oakland, working directly with current Oakland Mayor Libby Schaaf. As a member of the Association of Zoos and Aquariums, we are proud to say that all California accredited zoos practice protected contact. It is wrong to allow elephants to be cruelly treated in our state for the sake of entertainment. The only way to protect them from the bullhook is to prohibit its use. Thank you for your leadership on this important policy topic and for setting a path to a brighter future for elephants. I respectfully urge your yes vote.
Thank you for your testimony. Let's see if there's other people who wish to add their name and organizational support for this measure.
Madam Chair, members, Doug Houston with the ASPCA. We're supportive of Senator Lara's bill. Thanks.
Thank you.
Diana Vasquez with Sierra Club, California, in support of the bill.
Alicia Emerson, Office of Lieutenant Governor, in support.
Lieutenant Governor, okay.
My name is Denise Peck, and I'm with March for Elephants, and I'm in support of SB 1062.
My name is Daniel Armstrong. I'm here just as an individual in support of the bill and encourage you to please support it also. Thank you.
Christiana Milligan, representing In Defense of Animals. We strongly support this bill.
Scott Sadler on behalf of the Humane Society of the United States in support.
Debbie Casey on behalf of Earth Island Institute in support of the bill.
Catherine Doyle with Performing Animal Welfare Society in support of the bill.
Judith Reynolds, a member of Oakland Zoo and a supporter of Performing Animal Welfare Society in support of the bill.
Erin Hauge, Certified California Naturalist and Wildlife Advocate in support of the bill. Thank you.
Mara Guccione, Volunteer District Leader with the Humane Society of the United States, in support of the bill.
Erica Becerra from Stockton, in support of the bill. Gregoria Becerra de Stockton, California.
Hi, Lisa Bassi on behalf of the San Francisco SPCA in support.
Piper Kressel, HSUS District Leader, in support.
Sherry Lesniak, Born Free USA, in support.
Alex Gibbs on behalf of the City of Oakland, in strong support.
Hi, Michelle Knowles with March for Elephants, in support for the bill. Thank you.
Rigo Mastrodonato as a citizen, in support.
Anyone else in support of this measure? Opponents to this measure, do you have two primary speakers? If you're lined up for speaking against it, organized enough to have two primary speakers, and the rest will be adding on their names and organizations. Who would like to come forward and be one of the two? They would be sitting up here in this front row.
Got a big chair in the middle of us.
Welcome.
Thank you very much. I can't get scooted up.
Yep.
I'm Carrie Johnson with Have Trunk Will Travel. My husband Gary and I have grown up with elephants. We both started with elephants when we were teenagers. It's all we've done for our whole lives. And we are the folks in California, one of the two facilities in California that use the guide. We have elephants because we love elephants. We are good people. We have done great work for elephants. A lot of the research and the good things that have come for elephants have been because we have been able to offer our elephants to help other elephants as well as ambassadors. The thing that worries me about the bill is that we're not hearing from a lot of the experts. I have letters here from 25 researchers, veterinarians, and other people that have a different view, that believe that the guide is a good and humane tool to use for elephants. And we believe it too. We live with the elephants every day. I've been there when all of our 4 babies were born. I've held a baby in my arms as she died from elephant endothelial herpes virus. So we've devoted a lot of our lives to fighting EEHV, as it's called. We have a letter that is signed by veterinarians, researchers, conservationists, elephant managers, and care specialists. And I'll just read you just a short paragraph of the beginning. We, the undersigned veterinarians, research scientists, conservationists, and elephant care specialists, strongly oppose California Senate Bill 1062. We represent true elephant experts as proven by our years of service working directly with elephants in our individual and collective work in research management. The field conservation programs in support of the long-term survival of elephant populations, publications, recognition by our peers and professional CVs. SB 1062 would ban the bullhook, ANCUS guide, whatever you want to call it, the only husbandry tool effective for managing elephants in a free contact environment where elephants are not confined exclusively to their enclosures. And so we've added up the hours of all of these experts, and it came to 4,261 hours. So these are the people that I believe we should be listening to. We hear from the same groups over and over, but the vast majority of people are busy working for elephants and just don't understand that they need to make their voices known. So that's what we've hoped to achieve with this letter. And just looking for the past couple of days, I found 163 research projects that have been done with elephants, and that it was possible to do those because we have the aid of the guide. And it was our elephants that did a lot of those research projects that a lot of people of elephants have benefited from, and even PAWS. Our elephants were involved in the beginning research for tuberculosis. It's one of the few diseases that elephant gets, but it's devastating for them. So we were able to do a lot of that very basic research. PAWS facility has TB, and they have used, they've benefited from those methods. People all over the world are benefiting from what our elephants do. We do this because we love elephants. We don't wake up every day and say, oh my gosh, I need to go out and beat my elephant right now. I mean, who could live like that? I've slept with them in the barn. It's all we do. It's all we've ever wanted to do. And we are regulated by the USDA. They could revoke our permit if we did something wrong. California State Fish and Game, we get our license done every year, so they could revoke our license if something were wrong. Nobody that ever works at our facility has ever been charged or anything near being charged with animal cruelty. And there's a reason for that. It's because we are not cruel to our elephants. My husband and I have been villainized by, the groups that are putting this bill forward, and it's not right, it's not true, and it's not fair.
If you could wrap up, please.
Thank you very much.
No, excellent testimony. Thank you for coming. Next.
Madam Chair and members of the committee, thank you.
If you'd put that mic just a little closer.
Better?
Yes.
There it is. Okay. My name is Katie Allion. I work with elephants at a facility that is accredited by the Association of Zoos and Aquariums. I am a professional member of the Elephant Managers Association, and I also serve on their ethics committee. I am here today as the official representative of the Elephant Managers Association, which is an international nonprofit organization of professional elephant handlers, administrators, veterinarians, and researchers, and we very strongly oppose SB 1062. As elephant caretakers, it is our job to provide the best possible care for our charges. Elephants in human care settings can benefit from a degree of care that they would not get in the wild. They don't have to worry about landmines and snares, poachers, and habitat loss. But we are faced with the challenge of providing enough mental and physical stimulation to create a world that will keep them healthy and safe. That's one of the biggest differences between us and the wild. We can train these animals to allow us to take care of them. Using all the tools we have available to us, be it a guide, a target, pole, clicker, or whistle, we can train these animals to help us take care of them and lead them to success by providing clear visual and tactile cues that help promote welfare behaviors. We know that anesthetizing an elephant is the last resort, as the danger to the animal is significant. As a result, we have been tasked with managing these animals in such a way that we are able to control and contain them, to care for them if they become ill or are uncooperative. We are also tasked with being able to monitor them through blood samples and physical checks, opening the elephant's mouth on command, doing footwork. Caring for our aging animals adds another level of complexity to our jobs, as geriatric animals require even more care. The facility that I work at was reaccredited by the Association of Zoos and Aquariums in 2015, following their established policy, which has reduced the amount of time and circumstances in which we are able to spend in unrestricted space with the elephants. It has not, however, banned the use of the guide, nor has it completely eliminated shared space management with elephants. For example, our facility has an approved prescription for physical therapy for our geriatric elephant, which requires us to share space with her, and I've given you all copies of that prescription. When we do these therapies, we utilize target poles and the guide to maximize the value of her therapy to increase her quality of life. By criminalizing the guide, this bill would make it impossible. It would make it impossible for any facility in California to make that kind of decision in the best interests of their elephants here in California. They would not have the option of deciding what is in the best interest for that elephant in that situation. You would be taking a tool away from the people who would know how and when best to use it. This would inherently limit the opportunities to provide full welfare for these magnificent animals. Good elephant caretakers will tell you that limiting your options for the tools available to provide for all aspects of elephant care is unacceptable in any way. It would be no different than taking away a medication from a veterinarian. During a time when all wild elephant populations are facing critical threats, including and beyond the ivory trade, it is vital that we not tie the hands of the true experts from being able to not only provide opportunities for the public to meet elephants in person and form a lifelong bond with them, but also provide veterinarians and researchers the information they so critically need to help keep elephants a part of our world for future generations. Elephants like the Johnson's elephants have been critical in that effort. Please oppose SB 1062 and allow the existing laws and regulations which currently protect elephants to continue to work. Thank you very much for your time, and if you have any questions for me, I'd be happy to answer them.
Thank you for your testimony, but let's see first if there's other people that wish to add their name and affiliation at the microphone over here to my left. It's not time for additional testimony. I think they did a great job on that, so please.
Thank you, Madam Chair. Steve Chambers, Western Fairs Association, California Fairs Alliance. We're opposed to this measure. Thank you.
Thank you.
I did want to make just one clarification to Carrie's testimony. She had said that it's 4,261 hours. It's 4,261 years of excellent elephant care.
Okay.
Also, my name is Joanne Smith, and I oppose this bill.
Thank you, Joanne.
Hi, thanks everyone. My name is David Smith. I've been an elephant care professional for the past 13 years here in California, presently working in Vallejo, and I oppose this measure.
Good morning. My name is Thomas Albert. I'm the Vice President for Feld Entertainment, Ringling Brothers Barnum and Bailey, here in opposition. We actually submitted a letter of opposition that I believe was delivered to all the members of the committee, but for some reason was not reflected in the analysis.
We'll check on that. Thank you.
Because it points out we think the bill creates a legal conflict with state and federal law. Thank you.
Did we get that?
Trudy Williams. I'm an elephant handler and trainer with Ringling Brothers Elephant Center for Elephant Conservation. And I'd just like to say that when the tool is used properly, it's a perfectly acceptable and humane tool for elephant handlers.
Good afternoon, Cindy Cavallini. I am a professional member of the Zoological Association of America, also a professional member of the American Association of Zookeepers, and I strongly oppose SB 1062.
Thank
you. Daniel Gray for the record. California business owner. I completely oppose this piece of legislation. I strongly believe in conservation and promoting species for generations to come. And if this passes, it's going to be removing elephants from people's lives. Thank you.
Good morning. I'm Christine Borello.
Just bring that down.
Thank you.
You're a little bit
I'm Christine Borello, and I was born and raised around elephants my entire life. And I strongly oppose this bill. You're not only taking away proper tools. I'm 4'11", 98 pounds, and I've worked up to 4 elephants by myself, loading and unloading them in a truck.
Finish that sentence, and that would
sorry.
be it. It was name and affiliation.
I'm sorry. Anyways, you're taking tickles and hugs away too. Thank you so much. I oppose this bill.
Coming. I appreciate that.
Hi, my name is Brenda Horton, just an individualist. And I just would like to say that protective contact means no escape plan for like PAWS when the fire happened in Northern California. They had no way to get those elephants to safety because they weren't allowed any contact.
Point.
Thank you.
I'm Heather Groh. I have over 20 years experience with elephants. I'm here on behalf of Monterey Zoo and Elephants of Africa Rescue Society. We are the other facility this bill impacts, and we oppose the bill.
Gary Johnson, Half Truncal Travel. I oppose the bill, obviously. But, you know, the protected contact elephants, the majority of them have been trained in free contact. Like the Oakland Zoo, 3 of the 4 has been trained in free contact. Thank you.
Any other people opposing this bill? Just for the record, I don't see anyone else here. You 3 stay here, but let me open it up to see if there's any questions by members of the witnesses on either side. If not, I'm going to excuse the witnesses. You have a question for?
And I apologize that I didn't hear, excuse me, the testimony, but I have been reading and getting lots of emails.
Yep.
I've suddenly loved. Previously, I was ignored, and I'm not sure whether one is better than the other at this point, but certainly the people both in support and opposition of this measure have been quite adamant, quite vocal, quite passionate. The thing that I find interesting is that there is this concern that if we don't use this particular tool, we're going to lose that human or open contact, I think is the phrase that you use. And yet those in support disagree. So could you, those in support, explain how it is or what tools that we have now are still going to allow for this open contact, which sounds important, and I think elephants are fascinating. I mean, they're loyal and they're wonderful creatures, and maybe human beings should take a lesson in many respects. But that being said, you know, what is the best way to address the care and treatment and training of elephants, and why or what substitute techniques have become available to thus make this hook unnecessary or inappropriate, or has it always been? I know it's a lot of questions, but those are the things that come to that have been.
Senator Lara,
weighing.
did you want to answer that?
Madam Chair, if I can have Ms. Kinsley from the Oakland Zoo respond to that question.
Protected contact has been around since 1991. We were one of the first facilities to start using it because of the death of one of our keepers. It was stated before that 3 of our elephants were managed in free contact, and that's because at that point it was the only management style. And it's safer for the keepers and for the elephants to utilize a protected management style. When we train, we are still very tactile with them. They allow us to do blood draws and foot care and baths and ultrasounds and semen collection. Everything that we train for, we can still do and are very, very hands-on with them. If we're talking about the human-elephant bond, the elephants very much know who we are. They trust us. There's a trusting relationship there, so they allow us to do everything that we need to do to care for them properly, everything that's medical. We regularly have behind-the-scenes tours, so people, kids, families can see these elephants up close. So we're not losing anything there. Does that answer? Do you want me to elaborate more?
No, maybe to ask the opposition, why do you think that we still need to use this as a tool?
From our perspective, while protected contact management, you are able to provide care. You're able to provide care and protected contact. That doesn't preclude that you will have all the tools available to you. If you have an elephant that doesn't feel well, if you have an elephant, for example, my elephant that we have the prescription for, who's geriatric, she's 52 years old and she has some arthritis, the way that we are able to help take care of her is to go in with her and walk her and have her bend her joints and have her extend her legs and give her range of motion exercises. The way that we do that is to go in with her and spend time with her and have her cued to pick her legs up and bend them in certain directions. And that's only possible by having all the tools available to us. By not having the guide, going in with only one tool, I'm not necessarily going to be able to give her as many opportunities to be successful and give her a better quality of life. I don't go in with a guide and force her to do anything that she doesn't want to do. I help her understand what she needs to do in order to be healthy. Just like when we go to a physical therapist, you know, I've had to have physical therapy on my legs, and
yeah, but we don't have a hook there to make us do.
No, but it's something. I'm sorry, I'm not trying to.
I mean, most people I know, maybe there is some, I don't know, but.
No, I understand what you're saying, but it's a different animal. I can go to a physical therapist and they can say, I'm going to do this exercise with you, help work with me. I have to find a way to communicate with my elephant because she doesn't understand the words that I'm saying necessarily, that you need to bend this joint because you have arthritis, and therefore it's going to help you.
So you say there are no other tools available, that are methods?
I want all the tools to be available to me to help me take care of it.
So are you from Oakland Zoo saying that you could still provide this kind of care using something other than this particular tool?
Absolutely. We can cue them from the other side of the fence line right up next to that fence line. We can cue them to lift their joints. We have an elderly 47-year-old. We can cue her to lift her all of 4 of her feet, ask her to turn around, ask her to lay down. So we can cue them verbally and physically from the other side of the bars.
We do that as well at our facility. I'm sorry.
Do you have a follow-up question to either one of these people?
I think that I had asked the question and only gotten a partial answer. I'm curious as to whether or not there is any kind of protocol with various organizations that either limits the use of this tool or encourages the use of this tool. I mean, are we talking now about the difference, kind of like, you know, the parents who spank their children versus those who don't spank? You know, is that kind of punishment appropriate or inappropriate? Is that part of the analogy that we're drawing here? And this bill says no more, you can't spank your kids. Is that sort of where we're at, or?
I don't know if the analogy is adequate, but you know, Senator, there's experts on both sides of this. And we want to err on the side of do no harm to the elephants. And we know, despite of what the opposition has said, we know that this tool is used to intimidate the elephants. Why other else would it be a pointy hook used to so-and-so guide the elephant? This is a tool that's meant to intimidate elephants at a very young age. And we have experts, you know, the California Association of Zoos and Aquariums support this bill. Despite of what was said, you know, California Veterinary Medical Association is in a watch position. They understand, and we have over 6 dozen elephant experts from accredited zoos, zoo directors, elephant veterinarians, trainers, all who support this bill and have come up with alternative ways of handling elephants. And so what we've done here in this bill is to address the governor's veto of last year of instead of making it a crime, making it a civil penalty. And so I think this is a more kind of, it's a tighter bill. It's a bill that addresses the governor's concern, but also maintains the safety of the elephants, in my opinion.
So last question, if I may, Madam Chair. Is there any loss in relationship or in treatment that would result if this bill passed? That goes to the opposition.
The opposition, which one of you would like to answer? One of you will answer. Which one?
I will.
Okay. I think Siri wants to answer that question for me.
Yes, there is definitely a loss of contact, of physical contact. When we wash our elephants in the morning, we get in there and we scrub them by hand. We, you know, being able to go right in there with them gives us a feeling of, a more feeling of communing with the elephants. And we can give them better care that way. The Oakland Zoo, they gave papers at the Elephant Managers Association, and it says in there that they had elephants that they had to keep in restraint chutes for days because they couldn't let the elephant go because they wouldn't be able to get it back. It's like your child, you know, you have to take it in to get a shot, and it doesn't want the shot, but you can't give the child the choice of deciding whether it wants a shot or not. If our elephants are sick like that, we can just go right up and you know, take care of them and give them what they need.
Because you use this?
Yes, ma'am. Yeah, and it's not something that you can't beat an elephant into submission to make them obey you all the time. It's based on trust and respect. You have a relationship with that elephant. You can't just beat a child all the time and then expect them to do what you want, and they would not be reliable.
Beat a child anytime.
You can't beat any animal. You can't beat your dog and then go in with it for the rest of the time. I mean, they're not. An elephant is not going to stand there and be beaten. And the guide that they're talking about, it has a curved end to bring the elephant toward you, and the other end would push the elephant away from you. Sometimes you need that tactile.
So the part of the question then that I'd like the proponents to respond to is, by denying the use of this tool, will we see a loss of physical contact, a loss of the ability to commune with the animal, and a loss of the best type of care possible, which is what I just heard you say. Do you agree or disagree, and would you explain your answer?
I'd like to back up to the statement Carrie said about the elephant being in the chute. In that particular instance, this is a very sick elephant who had a case of salmonella, so she had to be hooked up to catheters to give her intravenous fluids. And so in that instance, she was very, very, very sick. So in that instance, that was the medical treatment that we had to provide for her. In terms of tactile touch and communication, we communicate through verbal cues that the elephants learn. In my 10 years, I have not seen an elephant refuse. They're very, very food motivated, and they like praise and they like tactile touch, depending on the individual. So I would say absolutely not.
So what you're saying is there is no loss of physical contact if we remove the ability to use this tool?
No, they will still do everything that we ask them to do. I can still use a scrub brush during a bathing routine all over their bodies because they walk up to a training wall and they enjoy the interaction.
Thank you.
All right. Questions or a motion? And a motion, maybe? Okay. Senator Allen? No.
For the witness from Oakland Zoo, so I see that so I guess maybe the main veterinarians folks are on a watch, but the zoo veterinarians, the American Association of Zoo Veterinarians, I'm not very familiar with all the different agents, organizations, but they're apparently in opposition. Is there a way? Do you feel as though in the case of a kind of a serious medical situation with an elephant where they're having a challenge moving it, that this could be problematic in that kind of situation?
We have protocols in place when there is a more serious issue. If there's a down elephant, we have protocols that care for them from the distance and motivate them to move. So we've had colic treatments where we've had hard time when they act a little bit more lethargic. So there's ways that you can motivate them to move, sometimes through food, to get them to relocate to where you want them to.
But let's say they're not responding to talk or touch or food, are you concerned about this, limiting your ability to move them in a way? I mean, people don't like getting shots. They don't like getting all sorts of things that they may be ultimately very good for them. In this case of an animal where you're not able to have a real conversation with them, obviously, are you concerned that this may limit your ability to treat elephants in serious medical situations if they're not responding to the more commonly used engagement or communication?
They do respond, and we do have an area where we can restrict them. So we have a chute is where we do part of their daily husbandry. They're also trained to provide restricted movement with tethers on their legs. That's a part of AZA, is what AZA requires us to do. So in those cases, that's what we would do if it was a more serious issue.
Okay. Do you have a sense why the zoo vets are opposed?
Maybe that's all they know, and they haven't worked in a protected contact facility management.
Okay.
We can provide a list. We have a list of over 70 people vets and researchers that are in support.
Any other questions? No, Senator Vitek, you had a question?
This could be for either side. It's for the first question, but how many elephants do we have in the state of California? I know some of them will be moving in and out of state, but how many do we have, roughly?
10. Oh,
total?
Oh, pardon.
Total.
There's dozens. There's
Oh,
quite
in
a
this.
few.
Oh, all in the state, not just. I see. Sorry.
Okay.
I'm not sure of the exact number.
Okay. More than one.
Yes.
Yes.
We got some folks out here. And in what percentage of the elephants in California have been raised with a guide?
I'm not sure of the number, so I'm not
Would be
sure.
over 50%, 60%?
Almost all of them.
Probably.
Almost all of them? 90% of them? 90% of them? And then you said you've been doing the other kind since
For 25 years.
for 25 years, but 3 of them had already been raised with a guide, correct?
Yes.
Okay. I know I'm 50 years old and somewhat untrainable at this point.
We can vouch.
And I mean, I've got habits, and I was trained and raised a certain way by my parents and my friends. And so if we have an elephant that's 50 years old, 25 years old, 15 years old, that has been raised with a guide, are they going to be able to learn in the last 2 years of their life or the last 20 years of their life to be able to do what they can today for their own safety and for the safety of the public and the trainers?
Well, we're an example of that because 3 of our elephants were in free contact and we transitioned them to protected contact. So yes, they're very open to learning. Was that the question?
Yes, did you want to ask the
I would like to ask.
opponents?
I think your point is a very, very important one, because the reality is that there have been no elephants that have been born into a 100% protected contact environment that have been raised to adulthood at this point. So even if, let's say, an elephant were to be born at Oakland Zoo and survive and reach adulthood in a protected contact situation, we don't actually have evidence of that. We have no science that shows us that those animals would actually be able to be provided the same level of care that the elephants who have been raised in a free contact environment with the guide currently have. The elephants at my facility, who are currently worked in a protected contact system, were originally trained utilizing the guide, so they learned those initial behaviors in protected contact. They understood what the behaviors meant, and then those behaviors were transitioned into protected contact. Elephants are very smart. Once they learn to pick up their foot, it's really not that challenging to then step outside of the yard and then say foot and have the elephant pick their foot up. They get that. You can maintain those behaviors from the outside once it's been trained from the inside, but we still don't know what's going to happen to the babies that are being born today, 25, 50 years from now.
Correct.
That's the question.
Right.
And we're making these decisions right now that are potentially going to have huge ramifications for these animals that are facing massive, massive threats in the wild. And these populations, like the Johnson population, they've been critical in learning and helping wild populations. So it's a very, very complex issue where, yes, you can provide care and protected contact, but we still don't know what that's going to look like down the road.
Right.
Our male was born into protected contact.
Excuse me. If you have another question to...
No, I'm just really concerned about what's going to happen. Folks don't understand what's going to happen. I've trained stuff myself, and
free to follow up with another question if you have that.
I'm good for right now. Thank you, though.
No, I don't mean to cut you off. I just didn't want it to be a debate, open debate between the two unless you wanted to ask for more information from either side. You're welcome to do that, of course. Any other questions of the witnesses? Senator Wilk?
Just make a comment, and I will move the bill. I thought you raised some good questions, Senator Vidak, actually. I thought that they were an item I hadn't thought about. We do not have any letters from the California vet medical folks, and they're the ones that I listen to with respect to animal issues, and I'm concerned about that. I think they have a watch position, you said. So do I. So for the moment, I will move it so it moves forward, reserving my right to disagree if they come in with a different position or concern. So I'll move the bill.
The motion will be due pass to appropriations. I'm going to excuse the 3 witnesses. Thank you very much for your testimony, and turn it back to Senator Lara for some closing comments.
I respectfully ask for a vote. I look forward to working with you all as this bill moves forward.
And the motion is due pass to appropriations. And one thing I took away from this lengthy discussion is, when this bill, as it moves forward, is there some thought on phasing out and transitioning to this different technique? It seems like it's doable. I think there were lots of questions that we're trying to zero in on management, maybe preferring the Oakland model, but how do you get from one to the next? That may be something you want to consider. It doesn't happen January 1st, where everyone's, so people, animals being trained in one direction. How do you gradually provide the training to the trainers, as well as getting the elephants to respond when needed in this different approach? So that would be my one suggestion on phasing in a transitional period.
And just to remind them, with the bill, this will not be effective until 2018. So, we are building in a phasing period.
You may want to explore through all sides, or maybe that's part of the veterinarian side. I'm not sure. All right, there is a motion. Do pass to appropriations.
Senators Pavley.
Aye.
Pavley, aye. Stone. Allen. Allen, aye. Hertzberg. Hueso. Jackson. Jackson, aye. Monning. Vidak. Vidak, no. Wolk. Wolk, aye. Stone, no. It has 4. It needs 1 more.
Okay, it has 4 votes. You need 1 more. 1 more? Or 2?
Monning's gone. Hueso.
Yeah, we have 3 members missing. So Senator Lara, you have 1 additional bill.
Yes.
Let me ask, Senator Stone is here. Could you